today is, all right guys, listen please. We are going to finish up we're basically done with most of our notes on the skeletal system. We need to also continue on to muscular system. But to start here, we'll talk about some possible injuries of the skeletal muscular system. So when we talk about the skeletal system, the bones, obviously probably the first thing you may think of in an injury or damage to the skeletal system is a broken bone, what we might call a fracture. They mean the same thing. A broken bone and a fracture, it's the same thing. And there's different types of fractures that a person could have. One type that you may have heard of is called a green stick fracture. Has anyone ever heard of that? No. A green stick fracture, it's called that. If you take like a dry branch you found in the ground and you break it, how does it break? It just snaps in half and that's it. But if you take like a branch that's on the tree and you try and break it, a green stick, how does it break? Yeah, like breaks partially, but there's all these strands of fiber still like holding it together. Well, that's what sometimes happens, especially in younger people, that there's a fracture, but it's not a clean break all the way through. Because for a long time, the bones are not fully calcified and hardened in young people, and so there's some flexibility there in those bones. And so sometimes a bone partially breaks, but not fully straight across, and that's what a green stick fracture is. In this example, there's been a green stick fracture of which bone? Raise your hand if you could tell me which bone is shown there. Michael? Yeah, that's the tibia. That's the tibia, that front shin bone. Another type of fracture is just a regular, simple, clean break fracture. This is a person that's fractured what bone? Raise your hand. Abby? That's the femur. That's that upper leg bone. That would be a very painful fracture. The femur is the largest bone in the body, and a fracture like that would be very, very painful. And what you also see is this bone is displaced. What do you think that means? Ryan?
Maybe that's facility to
sort of, but when it displaces, it means the bones, the two parts of the bone that are broken. No longer line up with each other. Okay, so that you could see one part of the top part's here and the bottom part's there. So what they would have to do with this type of break is what we call set the bone, which means basically realign the bones so that they line up so that when it begins to heal, it heals properly. Because if it stayed like this and the bone started to heal, well, first of all, it's going to be very difficult to walk because the bones aren't aligned with each other. This leg would be shorter than the other leg, so there'd be a whole host of problems. So they have to reset it. So they basically realign it, and really the doctor just probably uses his hands and moves the bone so it's back into place. And then what's the next step? After the bone is set, usually a cast. And a cast is just a way to prevent those bones from shifting around because the bone will heal. The bone regrows. It is living tissue and it will heal itself after a period of time. Another type of fracture that you may have heard of is a compound fracture, and that's a pretty gory one when the bone actually breaks and then protrudes through the skin. Okay, and again, that would be not something very pleasant. So they would set that bone, and then the process of healing begins. And this diagram shows that. So the bone is living tissue, and it bleeds after you break the bone. There will be some bleeding. Okay. The blood vessels are damaged. What happens as that bone begins to heal is the blood vessels start to reconnect in sort of that gap. The first types of bone to form is called spongy bone. It's more flexible. It's less dense. Eventually, that connects, and then eventually that starts filling in with what we call compact bone, the hard, tougher bone that fills in eventually until it's completely healed. And even though after it's healed, like if you were to get if you fractured your femur and it healed, and years later when you would go and get an x-ray, the doctor, the radiologist, would still be able to see where you had that break because there's a sort of an enlarged area where that bone healed. It's called the callus. So the bones, though, they do repair pretty well, and bone can heal quite well. Another injury that sometimes happens is a dislocation. Has anyone ever dislocated? So if we're talking about a dislocation, we're talking about a joint. Okay, so like an elbow or an ankle or a shoulder. And dislocation means the bone has been moved out of its usual spot. Anyone want to guess what joint we're looking at? Maggie? That's an elbow. Okay. And what's happened is you can see this is, raise your hand if you can tell me this bone. Maya?
Humerus?
That's the humerus, okay, and the radius and the ulna. But you can see that indentation there, that's where the end of the humerus is supposed to fit in to allow that joint to bend. But sometimes that bone can get forcibly moved out of place. Or if you were holding something and somebody smashed into your arm, the bone could come out of the socket. Okay? Often that would damage some of the tendons that hold that together. And then it's dislocated. It happens commonly in show, especially like in hockey, football, lacrosse, in sports in which you're like checking somebody. If somebody hits you like in the shoulder, okay, they can pop that shoulder, that ball, out of the socket, and it's difficult to move and it's painful. And then the doctor generally would, again, just basically using their hands, and they usually pull on this. They pull on the person's lower arm and just sort of pop that back in so that everything is in realignment again. Now there could also be some damage, like I said, to the tendons or the ligaments that hold that joint together, and some of the tendons that hold the muscle to the bone, and that would have to heal as well. The next one is a picture. So if you don't like it's a little gross. So if you don't like those sort of gory pictures, you may not want to look at this one. Oh, actually, first write that down first. So dislocation is when a bone is forcibly displaced or moved from the joint. So that's a person who has dislocated their ankle. And you can see that the ankle, this is where the ankle should be, but it's been dislocated and shifted out of the place, and so it has to be reset. You can also see here in the x-ray, there's a little fragment of bone that got sort of torn off. Okay? That's called an avulsion, because the dislocation, when that those ligaments and the tendons that hold all together get moved, can pull off a little piece of bone as well. All right. All right. So now we've talked about
Like in an injury like that, where your foot's like
sideways.
on the other side, what would happen to the Achilles tendon?
Those are pretty flexible, so probably it's fine. And after the ankle's back into the joint, then it would be okay. But sometimes if in a really bad position, it could cut off the flow of blood, or it can damage blood vessels and things like that, so it has to be corrected. All right, so now we're moving on. We talked about the skeletal system. Let's talk about the muscular system. So the muscular system is obviously related to the skeletal system. Okay? And muscle is, again, a type of tissue. And muscle is a type of tissue that can contract. When we say contract, we mean basically shorten. So muscle can shorten, and then it can relax. Okay? There's 3 types of muscle tissue in our body. I know you guys learned these in health. Can anyone name one of them? Michael? Smooth muscle. Cardiac muscle. Involuntary, sometimes called striated, sometimes called skeletal muscle. So skeletal muscles are probably the ones you think of. If you think about a muscle, you're probably thinking of a skeletal muscle. These are the muscles that move our limbs around and move our body. They attach to our bones. And like we said, they're voluntary. We have control over them. You decide when to move your arm and your hand and your head and so forth. So these are voluntary muscles. Your brain tells these muscles when and how to move, and they move. Cardiac muscle is muscle that's only found in where? Cardiac surgeon, or cardiac arrest. Those words all come from the same thing. Found? Yeah, it's your heart. Cardiac muscle is heart muscle. That's the only place these types of muscles are found. Are these voluntary muscles? No. You don't have to tell your heart, okay, beat. Again, you don't have to think about it. You don't have to contract your heart muscles. It just happens on its own. That's what involuntary means. It means it just happens on its own without conscious decision. And then we have smooth muscle. Smooth muscle is muscle that's part of our organs, like in our stomach, in our arteries, in the uterus. And this is muscle that it contracts as well, but it's also involuntary. Okay, you don't have to tell your stomach and your intestines you don't have to like push the food down by thinking about how you're going to contract the muscles in your intestine to push the food through your digestive tract. That'd be weird if you did. Oh, it's in the stomach, it's good. Small intestine. It doesn't work that way. It just happens on its own. Cardiac muscle, skeletal muscle, and smooth. We have many muscles in our body. There's over 600. It comes from muscle. Just got shifted over. And so these muscles, they can only pull on our bones. Muscles cannot push. And so most muscles, for many of our joints, they come in pairs. Pairs. They come in pairs. And usually the pairs are called the flexor and the extensor. If you think about how your elbow moves, it should make sense. So you have your arm, and if your arm is straight, okay, your muscles, and you have two muscles that move your hand up to your face. Your bicep muscle and your tricep muscle. Now they're made of separate muscles, but that's okay. Bicep and tricep. And so when you want to curl your hand up towards your head, what you do is your brain tells your bicep muscle to contract. And so it goes from being relaxed like this, and if you bring your arm up, and if you feel in your bicep, the muscle contracts. It's shortening. And that's pulling on the bones in your forearm. It's basically pulling your hand up. But now, once your hand is up, your bicep can't push it back down. Okay? Your bicep's contracted. It can't really push your arm back down. So how does your arm get back down? Abby? Yeah, now it's time for your tricep to work. So right now, my tricep is relaxed. When I want to move my hand back down, I contract my tricep muscle. You can feel it getting shorter. It's pulling on these bones this way, and it pulls my hand back down. So bicep shortens and pulls your hand up. Then your tricep pulls it back down. So these muscles, they work in opposites. One to pull in one direction, one to pull back in the other direction. Same thing with your knee. Your quadricep muscle, okay, your hamstring muscle in the back of your thigh. Okay, your hamstring pulls your foot up. Okay, and then your quadricep pulls it back down. These muscles work in pairs. So exercising your muscles by lifting weights, doing push-ups, things like that. What happens is that you are sort of stressing your muscles. Okay? You're putting them through a round of hard work. And they respond by growing stronger, a little bit at a time. Okay, so if you go to the gym and you're lifting weights, what you're doing is you're stressing your muscles. You're doing tiny little amounts of damage to the muscle fibers. And when your muscle fibers heal, they heal, but they're stronger and they're bigger. And they allow you to lift more weight eventually. And that's how exercising helps improve a person's strength, because the muscles slowly adapt to these greater stresses that you're putting on them. And again, that could come to, some people could do that to an extreme, like bodybuilders. Obviously, that's from when Mr. Arcuri used to actually work out. Spray tan must have missed his head then. All right, so we talked a little bit about these already, but we'll talk a little bit more about them. Remind me, tendons connect what to what? Tendons. Final?
Bones to muscle.
Yeah. Tendons connect bones to muscle. So the end of each muscle, like I talked about the other day, your bicep muscle, you can feel right at the end of your bicep, that thick thing, feels like a bone almost. Okay? That's the tendon that connects it to the bones. So when your muscle pulls, when your bicep shortens, it pulls on that tendon attached to the bone, and it pulls your arm up. Okay, so each end of the muscle is attached to the bone by this tendon. Achilles tendon there.
Why do those colors make me think of a horse?
I don't know. So the white part here is where the tendon is. The muscle basically pulls into the tendon. Oh, okay. This next picture, it shows, so just again, if you don't like this stuff, you don't have to look, but it shows a person who's having surgery on their Achilles tendon, and you can see that the doctor's holding on to it. So if you don't like it, you don't have to look. But this doctor this is the tendon he's holding on to, or she's holding on to. They're reattaching it back to the heel after it was ruptured. So you can see it looks almost like a bone. All right, it's gone. Then we have the ligaments. Ligaments connect bones to bones, and they form all of the various joints of the body. So those are tendons. All right, this one shows the tendons in a person's hand. So again, in your hand, you have these tendons. You could feel them in your hand. I'm not so sure about this video, if it's real or if it's just like animation, because I don't think anybody has the skin stripped out of the top of their hand, but maybe it's, I'm not sure if it's real or not.
That's real. Could be good enough.
Where's the, I think, yeah, you could see, maybe the video's not working.
It's good.
Dark good.
It's not, and so those tendons, as you move the muscles in your hand, these tendons pull on your fingers and they allow your fingers to move around. No, video doesn't work. Sorry. All right, so you probably have heard about if you sprain your ankle. So a sprain is when you damage the ligaments that sort of stabilize your ankle joint. So if you land on your foot sideways and you roll your ankle, basically you're stretching those ligaments beyond what they can stretch, and you tear some of them. Now, if it's a mild sprain, you may just tear a little bit of it. If it's a really bad sprain, you could completely tear all of those ligaments. And obviously, it hurts a lot. It's hard to move your ankle. There's some pictures here. So, an ankle sprain, basically, you tear some of these tendons that stabilize the different parts of your ankle. Okay, and they heal back eventually, but it takes a while. A bad sprain may have some bruising because you're bleeding underneath your skin. That damage bleeds, and that's what the bruising is. It starts to swell up. Okay, that's your body's trying to heal it. You may ice it to help reduce the swelling. You might take Advil or something to help with the pain. And then it takes a while for it to heal. And again, all those things are because of damage underneath the skin. There's an example of an ankle. Somebody had sprained their ankle. You can see it's all swollen up.
Why is he watching a football game?
What?
I didn't have a TV identifier.
And it swells up because of the healing of that tissue. All right, there are also some problems with tendons. So tendons, which connect muscle to bone, sometimes they can be strained. A strain of a tendon is when it gets sort of torn from the bone or ruptured. Like a ruptured Achilles tendon is a pretty major injury. If you follow soccer a few years ago when David Beckham was still playing, he ruptured his Achilles tendon and was out for a full year until that healed. Tendonitis, you may have heard of, is when the tendon that connects the muscle to the bone gets inflamed. Whenever you're using that muscle, it hurts. Trigger finger is when the tendons kind of lock and won't release. My dad had that. He had to have surgery to release it. Something that's fairly common. When the tendons come out of the sheathing that holds them, it's called sometimes tennis elbow. A person that plays tennis a lot often will get this irritation.